Hi guys, welcome back to my channel. Welcome to my channel if you're new here. My name is Zina on your screen. Thank you so much for stopping by. Let us dive straight into the video. Okay, first on the list is menstrual cramp. So menstrual cramp, menstrual pain, the medical term is dysmenorrhea. So not everyone, most women have dysmenorrhea, and there's a myth that once you give birth to your baby after your first pregnancy, you will not have menstrual pain again. Guys, what do you think? Is it true? Let me know. If I'm to answer that question, it is not true. For me, I had more pain after pregnancy. Yeah. Why do women have menstrual pain? So it can be normal here. You are bleeding, and this bleeding is shedding of the uterine tissue and then shedding of the egg that was not fertilized. So you're going to bring all those out of your system, and most women have pain because that happens, and other women have pain because of so many factors. Endometriosis, for example, most women will know this, some might not. Endometriosis is when the tissue that is supposed to line the uterus, the womb, grows outside the womb. So if you have endometriosis, you're going to have pain, heavy or prolonged menstrual periods. You're going to see your period for longer days. You're going to have blood clots, excessive blood clot, and of course you're going to have difficulty conceiving, so difficulty to get pregnant. Another thing that can make you have menstrual pain, menstrual cramp, is adenomyosis. So it is the opposite of endometriosis. So this condition, tissue that is supposed to line the outside part of the womb grows inside the womb. So it grows inside the uterus, and then because of this, your womb will be bigger. You're going to have heavy, prolonged bleeding. You're going to have blood clots. You also have menstrual pain, lower abdominal pain, and you're going to have painful sexual intercourse. This is the second pain that women have, painful sexual intercourse. And you guys, there are a lot of things, factors that attribute to medical term is dyspareunia. The first on my list, of course, is the adenomyosis. Sometimes might have painful sexual intercourse with endometriosis. You can have painful sexual intercourse with vaginismus. What is vaginismus? Technically, it's a fear of some or all type of VJ penetration. So someone that has vaginismus will have fear when it is time to be intimate, like penetrative intimacy. Do you understand? Why? Because you have the fear. So when it is time to be intimate, penetrative intimacy, your VJ muscle, the VJ wall, contracts. So any attempt to go in there will cause pain. So it's kind of a psychological problem, because some women that have this condition have had painless sexual intercourse in the past. So it can be because maybe a traumatic event happened, PTSD, post-traumatic stress disorder, can be as a result of what might have happened to you before. So in this case, you might have been abused sexually, and then you have the fear. So whenever you want to have a penetrative intimacy, you feel pain because your VJ wall contracts. Another cause of dyspareunia, painful sexual intercourse, is infection. Infection. Most women who have infection can have dyspareunia. They can have painful sexual intercourse, And the other things that can cause painful sexual intercourse, of course, when your down below is not lubricated, when it is dry, you can have dyspareunia. Yeah, another pain that women go through, that women have, is premenstrual syndrome. Now, premenstrual syndrome is symptoms, so more than one symptom or sign. Sign is what you can see, symptoms is what you feel. So if you have premenstrual syndrome, you're going to have back pain, you're going to have lower abdominal pain, you're going to have muscle pain, joint pain, chest pain, booby pain. You're going to have irritation, emotional breakdown for no reason. When does this happen? 2 weeks before your menstrual period starts, and so people might experience this few days before your menstrual period, 10 days. Yeah, so that is what premenstrual syndrome is. And so people can mistake this as being pregnant. Yeah, another pain that women go through is pregnancy. Pregnancy can come with a lot of pain. Name it, can give you malaria symptom like pain. So you're having fever, you're having abdominal pain, you're having joint pain, and you'll be like, I think I'm having malaria, let me go treat malaria. No, you're not having malaria, you're just pregnant. So you run the test today if you're having these symptoms, so that you can avoid taking anti-malaria medication, because it can be harmful to your growing embryo, to your growing baby. Okay, pregnancy can cause a lot of pain, like physical pain, mental pain, emotional pain, like any pain you can think of. Another pain that women have is ovulation pain. There's a name for it. I don't want to bore you guys with the name of this pain, maybe because I cannot pronounce it. Maybe because I cannot pronounce it well. But yeah, so when you have ovulation pain, you have lower abdominal pain. It's going to be either on the right or the left. So ovulation pain, when you are ovulating, you are releasing eggs. You get me? So most women have ovulation pain. Some might not have, some have a certain degree of pain. Some can be very excruciating that you need to go to the hospital, the same as menstrual cramps. Yeah, so you can either be on the left or right side. And most women, when they have this pain, they know, oh, I'm ovulating, let's jump on the bed, let's be intimate. Postpartum pain is usually not talked about. Yeah, postpartum pain from the stitches, postpartum pain from just pushing the baby. If it is CS, postpartum pain from the CS side, postpartum pain from the anesthetics that was given to you, postpartum pain from your womb contracting, like you've pushed out the baby but your womb is still contracting. Like, why? You all know that after giving birth your womb contracts, and this is because it needs to go back to its original size. Most times it really doesn't go back to its original size. So the amount of pregnancy you have, the larger or bigger your womb will be. Another pain that a woman can have, breastfeeding and contracting. If you know, you know. As you're breastfeeding, your uterus is contracting, or as you're pumping your uterus, your womb is contracting. This is because you are releasing oxytocin. And once you're breastfeeding, you're releasing oxytocin. That is the hormone that will help you release that breast milk. Prolactin, the hormone that everyone know about, is the one that is responsible for the breast milk production. So as you are breastfeeding, you're releasing oxytocin, so your womb is contracting, and that's not nice. It's not pleasurable. It is painful. Another pain that women have or pass through, however you want to put it, is breastfeeding pain. Can I hear you all say breastfeeding pain? Breastfeeding pain. So there are two types here. The one that when you're breastfeeding and the milk starts coming out, before it starts coming out, you feel like pain-like sensation. You get as if someone is using pain to shook your breast, so it is painful, and then the milk comes out. Another pain from that area is where that newborn baby or that infant or toddler latch on the breast. It is painful. And also when you are finding it difficult to breastfeed, your nipple starts bleeding. Yeah, it is painful. When you've not breastfed for a long time, your chest gets engorged and it is painful. When they start teething and they clamp down on your breast while breastfeeding or when stopping, it's painful. In the comment section, guys, which of this pain did you have, or do you have, or are you having at the moment? Tell me in the comment section. Let us discuss in the comment section. I hope you enjoyed this video. If you did, please click that thumb up button, drop a comment, share this video to your loved ones, your family, your friends, everyone, and subscribe to my channel if you haven't. I will see you all in my next video. Until next time, take care of yourself and bye. Mwah.